Hi there, how are you? I hope you've had a great summer and that things are going well for you. I wanted to say hello and start up Derm Path rounds again in our group. And so I've got a case to share with you today, and we'll go through that and we'll discuss it. And I'd love to hear your comments and thoughts. Please post them below the video, and I'll try to get back to you as soon as possible. I'm gonna see if I can try to monitor them in real time, but not sure how that will go. So let's go ahead and get started. The case I have to share with you today is of a young puppy that is from Texas and is a foster dog right now. And he was adopted by his foster owner, or was picked up by his foster owner. And she knew he was going to have a wound, but she wasn't aware of how extensive it would be. So these are the photos she provided, and you can see it's a very extensive lesion. And it's all the way along the dorsal midline, pretty linear, fairly well demarcated. And it's raw and ulcerated in the center, and then it's got some areas of pallor around it. You can see already perhaps it was even larger, and there's some scarring and healing perhaps already starting to happen, and contraction. And so he is in Texas. So, and it's August. So these are important features to keep track of. And it was diagnosed by the vet as a burn. And so the dog was started on treatment with silver sulfadiazine, which is very common treatment as far as I understand. For anyone that doesn't already know, I am a veterinary pathologist and treatment is out of my wheelhouse. So I say get thee to a veterinarian or veterinary dermatologist as soon as possible if you need specifics on treatment advice. But this lesion is so interesting and so distinctive. I wanted to share with you what it looks like histologically. Please forgive me, that is my cat Newton in the background. Yeah, okay, here we go. So this is my cue to switch over to the histopath. Let's see if I can make that happen. All right, so I'm hoping that you can see this. And what we're looking at is, this is actually from a different case, but the pathophysiology is the same and histologically changes are identical. And we'll talk through about different possible causes and what other differentials are. But I just wanted to explore this histologic pattern with you because it's something that we see from time to time, and sometimes we get the history that goes with it, and there's some interesting possible causes that I thought would be fun to discuss. So first off, we can see at low power, like I mentioned, this is from a cat, and so it's a completely different case, but histologically, if you were to imagine it from the dog, it might be very similar. So we see here at the edges more normal epidermis, we see hair follicles, adnexal structures, and then we have our subcutis, and then we have our muscle layer, and then more adipose tissue. And what we're looking at specifically, though, is I'm sure your eye is drawn to this area, and something I'm hoping is going off in the back of your mind that is inappropriate, which it is. So what's happened here is we have this wedge-shaped area of necrosis. It's deeply eosinophilic. We have loss of all normal cellular detail. You can see here, if we take a closer look at the hair follicles, they are essentially not frozen in place, but they're completely coagulated. This is coagulative necrosis. And we have complete loss of the normal cellular detail of the follicular epithelium, and that's an important feature this diagnosis. This is a burn. This one happened to have a history of having been in surgery prior to this lesion developing. Burn lesions, thermal injury, chemical burn can look identical. So oftentimes we have to rely on the location of the lesion, the clinical history, signalments, and then any other details that we can identify. Say if there's any suture nearby or heating pad was used, things along those lines. And then there will be more that we'll cover in a little bit. But what I want to draw your attention to is just how all of these hair shafts and hair follicles are still entrapped and in place, but all the tissue around it is necrotic. And we have complete loss of the normal detail of the follicular epithelium. That's key. So if you notice, if we go back again to this low power, we have this zone here, you could almost describe it, and it's fairly well demarcated. And this is all coagulation necrosis. And we've got some hemorrhage in here and tissue that is necrotic, especially after this type of injury, is especially prone to secondary bacterial colonization. So it would not be uncommon to find bacteria growing on the surface. And then we have another zone here. And this is the zone of stasis or inflammation. And this is usually less well defined, and it starts to ooze out and spread out infiltrate into the surrounding soft tissues. And this is often heavily neutrophilic, but it can be a mix of inflammatory cells, lots of fibrin, and then we get into the zone of stasis, or rather hyperemia, and that's this outer layer, sort of not as clearly demarcated from the inflammation, because certainly there is inflammation here as well. But this hyperemia is where you can see blood vessels are congested, and this is where blood flow will start to return. This tissue is probably viable. This zone here of stasis and inflammation is sort of the in-between. And this coagulation necrosis area is irreversible cell injury. That's not coming back. So it's important to note that here we have the epidermis is intact, and then this all looks good. But then when we come over into the center, it's all completely necrotic. And those are the major features. And when we look at burns, there's another way we can evaluate them. We look at the depth of the injury. So we look to see if just the epidermis is involved, the dermis, how deep it goes. Does it involve the subcutis? Does it involve the underlying muscle? And we do have inflammation and necrosis here in the muscle layer, and even extending into the deeper underlying adipose tissue. So that's quite a remarkable burn. It's very deep, at least second or third degree. And then there is some thought I've read in the human literature, and folks, please let me know if you have another opinion, if fourth degree burns can go down to the bone and deeper tissue as well. So with that in mind, let's go back to our case that we were discussing. And this is just showing you, again, that necrosis of the follicular epithelium, coagulation necrosis in particular. And that's something that's distinctive to burns and would help you to differentiate it from something along the lines of, say, erythema multiforme or other types of conditions. As I mentioned, the three zones of burns are the zone of coagulation, and that helps you to identify it as an outside-in injury rather than an inside-out injury like you might see with vasculitis and thrombosis. You will still get evidence of some secondary vascular damage, and you can see thrombosis with thermal or chemical injuries and burns. But it's important to differentiate which one it is. Is it outside in from a thermal injury or chemical injury, or is it inside out from a primary vascular problem? rather than secondary bystander. Then we have the zone of stasis, which is the increased vascular perfusion and the marked cellular inflammatory infiltrate. And then we have the zone of hyperemia. And this is another case. And please shout out if this is one of your cases. This is from back in 2018. And this is before I had a way to track this, who submitted this, but I want to give all credit where due, so we can make sure everyone gets credit. And if you have history about this, I would be most interested. So all I have in my records right now are the clinical photos. So we're looking obviously at the dorsal area, and we have a bit of an eschar here and some lesions down here as well, slightly on the lateral aspect. This does look a little bit different from our first case, where it was a very straight line right along dorsal midline. And here's a closer look. We can see there's the haired skin surrounded by a zone of erythematous tissue that's sort of pulling away and separating. Looks, you could imagine it looks very similar to what we saw in the cat. And then we have more normal skin around that. Another view of that. And so again, this is from this doc. This is the histopath, and I just wanted to show the zone of coagulation necrosis, the zone of stasis and inflammation, and then that zone 3, the hyperemia, and we have return of blood flow. You can see how congested these blood vessels are. I just wanted to show that, and we'll note once again, to beat a dead horse, the follicular epithelium is necrotic. So you can imagine that this is coming from the outside in. We see necrosis of the epidermis, and it's coming downwards. That's important to note. And this is from a different case. And this is showing how we have the deep necrosis, and it goes down into the paniculus. You can see again those zones and bands between the coagulation, necrosis, inflammation, and then the more viable tissue at the margins. We do have some mineralization of the outer root sheets, and then we do have necrosis and inflammation that extends down into the adipose tissue, into the paniculus, and then we even have some inflammation and mineralization down in the underlying muscle. This is just a closer view. We have some multinucleated giant cells that are coming in and cleaning up some of that damaged muscle. You can see there's evidence of myocyte regeneration. The nuclei are normally more peripheral, and they're starting to move more centrally, and they're enlarged. So we have muscle damage. This is another example of a burn. We have the coagulation necrosis. You can see it's involving the epidermis, dermis, paniculus, and then down into the muscle and the deeper adipose tissue. It's just a closer view. It's there is some artifact here, but it's coagulation necrosis. And then that band of inflammation. Another example, I'm just going to show you a bunch of them. There's all different ranges of presentation for these lesions, but the massive coagulation necrosis here, you can't even identify the epidermis very distinctly. And then sometimes it can just be pure eosinophilic tissue. And I was taught by one of my professors in vet school that on histopath, red is dead. So this is irreversibly damaged tissue. And we even have wipeout of the sedation. So more examples. I think I'm hoping that you're getting the picture here, and this is you're seeing a pattern. So again, we have those different zones and distinctive areas within the lesion. And then for contrast, because we talk so much about outside in versus inside out injury, and I kept harping about the necrosis of the follicular epithelium, to contrast with a primary vascular lesion. This is from a cat, and this is skin from the tail, and it had vasculitis with thrombosis and necrosis. So this was a very deep lesion. And so this was inside out. And we have follicular epithelium, but you can still identify the nuclear detail. And what's also important to notice, while there's lots of congestion here in the vessels and there is necrosis, the collagen around the hair follicles is fairly well spared. That's the last to go with coagulation or with ischemic or any type of necrosis. The collagen tends to hold up pretty well, but with thermal injury, that will be completely damaged, like coagulation necrosis, versus here we can still identify those nuclei in the follicular epithelium. So that's my interpretation. You may have a different interpretation, and I'm open to that if anyone would like to weigh in. But you can still identify nuclei here in the epidermis and here in the follicular epithelium. And to me, this looked a very different pattern. This is primary vascular. And this is a fibrin thrombus within the lumen of a vessel. All of this tissue is ischemic surrounding it, but that was what I wanted to share with you about that. All right, so what caused these lesions in the original puppy or in that other dog that I showed? Well, this is where there's a little bit of discussion. So there's a great paper by my resident mate, Erin Quist. Hi, Erin. Hope all is well with you. She's a fabulous pathologist, very talented. And she wrote this awesome article with some colleagues at Texas A&M and at Antech. And they did a case series, and she actually recreated some of the conditions with the garden hose out at high noon in the Texas heat and measured the temperature of the water in the hoses. And the water would get very high, at least 120 degrees, and that's the temperature that's required to cause a scalding injury. So they found linear thermal burns along the dorsum in a number of dogs. And they found that they were anywhere from second to third degree burns. But they also note in this paper that, as we were talking about earlier, you can't tell what actually caused a burn. Was it chemical, thermal injury? You can only really identify how severe it is, first degree, second, third degree, and so on. So I thought that was very interesting. Most of the cases from their study were from the south and southwest of the US, where it gets very hot. And they also noted a seasonal component. These are some images from dogs. They had, here's a brown dog, here's a darker colored dog. And they have this very linear pattern straight down the top line. And 3 of the 10 dogs, if I remember correctly, had a history of being sprayed with a garden hose in the days before these lesions appeared. Because if you remember, with thermal injuries, with thermal burns, it can take several days for the lesions to fully declare themselves. So she did this awesome experiment. I remember her telling me about this, where she recreated the environmental conditions on a hot summer day in June. And I thought that was so clever and very creative. And sure enough, the temperature came back 2 hours later when they checked it was at least 120 degrees. So that certainly fits. Then they also noted, though, in their discussion that intense sunlight has been reported to cause severe thermal injuries, similar to what they were seeing with the scalding from the garden hose, or what they were proposing in some of the other cases that didn't have that history, but had that very unique pattern grossly. So solar radiation could be a differential for some of those other dogs that didn't have that garden hose exposure in their history, or maybe the owners forgot about it because it can take several days to declare. So I thought that was very interesting, very well done study. So if you're looking for something to do this Labor Day weekend, I highly recommend giving this paper a read. And I thought they came up with some really good criteria for making this diagnosis. It was very specific. making sure that having that element in the clinical history that the dog had been hosed off with water from a garden hose. So you can see these are the 5 criteria that go into their diagnosis. And so I thought it was very well done. But as I also note, with burns, you can't differentiate histologically from any other type of thermal burn. Say something from, a hot engine, car engine, in a kitten or something like that. So then another great paper came out, and this one is by Dr. Schwartz and the folks with Dermatology for Animals and Dr. Leffler. And this was dorsal thermal necrosis in dogs. And this was a retrospective analysis of cases. They had a few more dogs in their case series. And this was also involving primarily dogs in the Southwest US. Also, if I recall, it was usually during the warmer months. So similar, there's a lot of overlap here. So they also found very similar histologic findings, of course, partial or full thickness thermal burns. So very interesting. And then a lot of overlap, also some more mini dachshunds. They seem to be showing up here. And then all different colors of dogs as well. Mostly darker, but some lighter colored dogs and all different lengths of hair posts as well. So these are some images from their study, and we can see that there is certainly extensive necrosis and an ulceration, and you can see that the tissue is starting to peel away. This one's a bit further along. In my opinion, and feel free to say I'm out to lunch, I think this pattern looks a little bit different. I agree, they describe it as being more serpiginous. If we go back to the case that I showed originally, it's a very distinctive, very straight line right along dorsal midline. So my hunch would be that this is due to scalding from a garden hose, but it was picked up as either a stray or somehow abandoned or something, ended up in foster care. So we don't actually know, but I do think that there is some difference. So my hunch would be a possible scalding, but honestly, I really couldn't say if it was due to dorsal thermal necrosis from solar injury, because I think that's absolutely a possibility in August in Texas. And then this case here was confirmed as dorsal thermal necrosis, and this is also right along midline. So I think there is certainly a lot of overlap, and they theorize that perhaps some of those cases from the garden hose case series that didn't specifically have that history of exposure to water from a hot garden hose, that perhaps they would better be classified as dorsal thermal necrosis, which I thought was an excellent point, and really made me think about that. So I went back and, of course, reread it. And then this case of this puppy came up. And so I thought, all right, let's see what the folks in the Vet Derm Path Forum have to say. So I wanted to share this with you, and I'd love to hear your thoughts. Please put them in the comments below, and I'll reply afterwards. And I hope you enjoyed this and found it helpful, and I'll see you next time. All right, take care.